Doctors, who's the dumbest patient you've ever had? Story 1. I thought this only happened in TV shows, but one of my sister's friends is a doctor and told us about a teenage girl that came to the ER with abdominal pain. Yes, this is going where you think it's going. When asked, she swore up and down that she couldn't possibly be pregnant. They ran the usual tests, and wouldn't you know it, the girl was pregnant. She could not believe it, total denial, but she did not deny making love with her boyfriend, so the doctor, my sister's friend, asked her what birth control they used. Apples. She ate an apple after having deed with him. Story 2. My mom worked at a major hospital and heard the story of a guy who called the emergency line saying that he'd accidentally stuck himself in the torso with a knife while cutting something. Their first piece of advice was to not remove the knife, to which he replied, "What do I do if I did remove it?" And they gave him instructions. When the ambulance arrived, they found the man with the knife in his torso. Yep, he put it back in. Story 3. This doesn't exactly fit the criteria, but it's close. Not a doctor, I'm a nurse. And not a patient, family members. Back when I still worked in the ICU, I had a family come in during visitation to see their loved one carrying one of those plastic containers from a grocery store bakery with half a dozen cupcakes inside. Not unusual. Families would bring us food all the time, and it was incredibly nice, and we always appreciated it. Note, I walked into the room to update them on the patient, and we talked about it also being her birthday that day. They gestured toward the cupcakes and said that's why they had the cupcakes with them. I thought that was really sweet. They were going to celebrate her birthday with her even though she was in the ICU. Then they hand me the container and look at me expectantly. I look back, unsure of what my next move was supposed to be. Aren't you going to feed them to her? This woman was on a ventilator and on IV sedation. It took me an embarrassingly long time to explain to these people why she couldn't eat while she was unconscious with a breathing tube in. Nice folks, not terribly bright. Story 4. Worked at an urgent care for some time. Late teens patient F comes in with mother for abdominal pain. I have a student doing the initial history and exam. Swears there is no chance of pregnancy, but is physically active with SO, but swears no penetrative work. Well, we get the urine results back. She's pregnant. Student goes back in, asks the mother to step out, and has to have the most awkward conversation with this patient, detailing what physical lovemaking was. Well, it turns out she was indeed not having penetrative work with a male organ. The happy couple would fool around and then use the male's fluid as lube. They thought that to get pregnant, the male organ had to fall off and become the new baby. Story 5. The other day, an established patient came in for an emergency dental visit because all of his teeth were hurting worse and worse and worse, to the point where he could barely touch them with a toothbrush. The pain started a few weeks after he had started swishing with peroxide every day. He had decided he wanted less bacteria in his mouth, and he decided that swishing with peroxide would be the best way to do this. But now, every time he used the peroxide, his teeth became severely sensitive and painful to touch. Me wondering how to gently break the news to this otherwise bright guy that he was being dumb. So, have you tried not swishing with peroxide? Him, well, no. Me, well, try that. What do you know? Problem solved. This is certainly not my dumbest patient encounter, but it was recent and the only one that comes to mind at the moment. What made this patient dumb was not the fact that he swished with hydrogen peroxide. Many people do this, and it really doesn't hurt or help them. Maybe it makes them feel good. In this guy's case, it caused him a ton of pain, but he didn't realize he could just stop doing the thing that nobody told him to do. To me, that's a dumb moment. Story 6. I doctored here? I have two groups of dumbest patients I see regularly. People who abuse their contact lenses and end up giving themselves corneal infections and other issues, and people who don't wear safety glasses when they should be. It's not hard to take your contacts out before bed and clean them properly, or throw them away if they're a daily disposable. It's not that expensive to change your contacts as directed, and it's a lot cheaper to not have to visit my office multiple times for medical visits, where I'm trying to save your eye/vision from your laziness/idiocy. I had a patient just this last week with 20 scars between his corneas from previous infections, a new record for me. I also take metal and other foreign objects out of people's eyes almost daily, and 99% of the time, the patient wasn't wearing safety glasses. I've had an instance where a patient had a piece of metal wire from a wire brush penetrate his eyeball, and he decided the best thing to do was pull the metal out and wait 3 days before getting it checked out. He had a case of endophthalmitis, a severe infection inside the eye that, if not treated aggressively and quickly, will make you lose your eye entirely. He needed emergency surgery and was lucky enough to have the eye saved. Another patient wasn't wearing his safety glasses, and a piece of metal hit his eye at high enough velocity it penetrated into his vitreous and was floating there when I looked in the back of his eye. He also needed emergency surgery. Please take care of your eyes, people. Visit your eye doctor regularly for examinations, just like you do the dentist. We can only replace certain parts of the eye, and losing vision in one or both eyes can be extremely difficult to get used to physically and mentally. Story 7. I'm a PhD clinical psychologist, so not a physician. Patient came in for an emergency appointment. Usually these are folks who are unhappy, recently hitted, manic, or in psychosis. He filled out all our paperwork, so any questions about mental health history, and sat in our waiting room. I can't tell you how clearly this is a psychological services clinic. Finally, he gets back to my room, sits down, and pulls up his pant leg. Starts taking off his shoe. My man had ankle pain. Me, I'm really sorry you have been waiting for so long, but unless you want to talk about how your ankle pain is making you feel, there isn't anything I can do. It took a little convincing that I wasn't holding out on him. No, I wouldn't just take a quick look at it. He was baffled and kept saying, "But you're a doctor." I'm not convinced I successfully explained the difference between a psychologist and a physician. I don't even think he was med-seeking. He was freshly 18 and not the brightest bulb. He eventually limped off to the nearest urgent care. Poor kid. Hope he's okay out there. Story 8. I have two good ones. First, my sister's a doctor and she saw a patient and prescribed meds. Asked them to come see her a week later as a follow-up. Patient comes back next week saying that they don't feel better at all. Sister asks to see the meds she prescribed to ensure they got the right ones. Patient says they never picked up the meds because they only wanted meds with organic ingredients, not one full of chemicals. Second, husband comes in with a set of complaints. Sister proceeded to check him out and found that there was nothing wrong with him. That's when he told her that it's actually his wife who had those symptoms, and he never brought her in to get checked. On top of it, he was pissed that the doctor couldn't just fix his wife without seeing her. Story 9. So veterinarian, but I have a few good ones where humans wanted me to treat them. My first week in clinical practice, I had a client that called in telling us she had taken her cat's flea medication, Prodelio, and wanted to know what to do. She became quite hostile when we instructed her to contact human poison control and a human doctor, and insisted that because it was a veterinary meds, it needed to be treated by a veterinarian. I had another client who was convinced he had gotten worms from a puppy and decided that we needed to test his stool as well. We told him he needed to speak to his own human doctor. He got angry and informed us that he doesn't want to go to the doctor and defecated in the middle of our lobby. I had a client call the board of pharmacy on us because we filled her pet's medication, flea/tick/heartworm prevention, but informed her that we couldn't fill her personal medication because as a veterinary hospital, we're only allowed to fill pet meds. We also offered to script out the pet meds to an external pharmacy that could handle both if she wanted to get both from the same place. The person that contacted us from the state board was just as confused as we were. I had a client bring in his own hip x-rays for us to evaluate and try to pretend they were for his dog. He was genuinely surprised that we could tell right away they weren't from the dog. Although as far as stupid goes, I had a client who bought an Aussie Doodle from an Amish breeder and was so enthralled with him that they went back a month later looking for a mate to breed in with, and was lucky enough to find a female from the same parents, with the same birthday and everything, and so it must be destiny. It took us a really disappointingly long time to explain that these dogs are siblings and should not be bred. They were convinced that they couldn't be siblings because he was mounting her. They'd ironically named the dogs Luke and Leah. Story 10. Retired GP here. I had a male patient aged mid-50s who presented with trouble peeing, decreased flow of pee, and occasional blood in their pee. I immediately referred the patient to clinical triage with a recommendation for an initial MRI to look for prostate cancer. The patient returned to see me 3 months later. Symptoms had worsened and included bone discomfort and pain. Turns out they had refused any MRI and blood tests and had gone instead to a homeopath for 3 months, utterly useless. Unfortunately, in those 3 months, the cancer he had spread to his bones. He passed away within 6 months. Story 11. I'm definitely not a doctor, but there was a period of about a month when my grandparents were having some concerning health symptoms. My grandpa wasn't as bad, just lethargic, but my grandma was seen with a far-off look and drooling into her lap when she was a perfectly capable woman. My family somehow found out that they both had med prescription changes after a recent doctor visit and concluded that what was happening was likely their meds interacting. They were asked if the doctor told them to get off the old meds before starting the new ones. My grandpa said, "Yes, but we didn't want what was left to go to waste." My parents were in charge of periodically checking their meds after that. To be fair, my grandparents grew up during the Depression era, which could explain their reasoning. Story 12. Had a patient that superglued a crown back on number 10. He wasn't a usual patient, but his dentist wasn't open that day. He didn't get even close to down all of the way, so this crown was keeping him from closing. He got mad at me when I told him not to use super glue. He said, "Okay, smart guy, what should I use to put a crown back on?" He was giving me the smuggest I can't close all the way smile he could. In one of the rare times I got a retort out with good timing, I replied, "A dentist." My assistant ran out of the room, and I could hear her completely lose it laughing down the hallway. The patient wanted me to fix it, which was to cut off the crown and make a new one. I asked him what his medical history was. He already signed one he filled out, but I always ask because people leave stuff off, and specifically asked about heart procedures. He said he just got out of the hospital 2 days before, from having 4 stents placed after a major heart attack. When I asked him why he didn't put that on his medical history form, he said, "You're a dentist, you don't need to know that." Told him I need a medical release for treatment from his cardiologist, and I would not do anything until I had one. He seemed not to understand that his mouth is attached to the rest of his body. He was pretty mad I wouldn't do what he wanted, but I didn't want to call for an ambulance that day. Story 13. In medical school, a patient came in for abdominal pain. During my series of questions, I asked if the patient could be pregnant, and she said no because she is a gay. The attending had us order a pregnancy test in addition to blood work anyway. Pregnancy test came back positive. This time I asked the patient if she was with a man. She responded yes, but was confused as to how she could be pregnant if she's a gay. My attending replied, "Honey, the fluid don't care if you're gay or not." It blew my mind that she didn't think she could get pregnant simply because she identified as being a gay. Story 14. During my intern year, a male patient in his mid-20s gets admitted to the surgical floor for third-degree burns in his right hand. I go to check on him and do the normal interrogation. When I asked him how he burned his hand, he proceeds to tell me that it was a minor burn at first, just a little redness on some of his fingers and palm, because he touched something hot, and his friends told him that in order to heal it faster, he should boil an ointment that has cannabis with peyote, and then to put his hand in it, which is how he ended up with third-degree burns. Some people lack common sense. Story 15. Not a doctor, but work in medicine. Shout out to the patient who in one visit told us that insulin didn't work for her personally, and that her diabetes worked differently than other people's. Also in the same visit, she ill-treated the poor medical student. She told the medical student that it was her 7-year anniversary. The medical student congratulated her, and then she goes, "It's the 7-year anniversary of the date he left me." Medical student was mortified, and I was super annoyed. Like a lady, why? How was the poor medical student supposed to know? Story 16. I'm not a doctor, but I work in a hospital emergency department. We had a young woman who closed a car door on her hand and severed 2 fingers. She brought them along in a Ziploc bag. Obviously, the car door didn't make a nice clean cut, so the fingers were not able to be reattached. She was furious, yelling and smearing blood everywhere. She left A&MA without letting the doc stitch her hand. A little while later, the computer showed she had checked in at the emergency department at our sister hospital. Someone wondered aloud whether she'd be able to talk them into trying to reattach the fingers, and I said nope and held up the Ziploc bag she'd left behind. Story 17. The hospital my wife worked for asked her if she could see Tony at 5 o'clock for a quick follow-up. 10 minutes. Now other doctors, there were the "it's 5 o'clock. I'm not staying into 5-1 unless I'm on call," but she said sure, she figured it was an issue with medicine, and just changed the dose. Patient walks in with an entire Social Security disability packet that he needs today. My wife could have been exaggerating, but she said at least 50 pages, plus copies of his notes and records. Then proceeds to tell her this might take longer than 10 minutes. I had to lie to get the appointment, but I can wait. Story 18. My friend told me this story. She was sitting in on consults for training. This one in her 50s came in, new patient. She reported a few symptoms, but whenever the doctor suggested a test or treatment, she refused. She then wanted a letter saying she wasn't crazy. She denied the option to see the on-site psychologist. She wouldn't leave without a letter or copy of her notes to prove she wasn't crazy for her divorce or something. So the doctor gave her a printout of the consult notes, which said she refused all treatment. She left happy. Story 19. Not dumb, but with very odd priorities in my eyes. Crippling pain in her feet, toes deformed and bruised, and all she wanted was injections against the pain. Her shoes were way too small, but larger ones are utterly refused to get fitting shoes. Sorry, it's not my job to help someone hurt themselves. At least Cinderella's stepsisters had a prince and kingdom to win. Maybe I'm just not into fashion enough. Different workplace, dumb colleague. I asked the patient why they came to inpatient rehab. My GP said I needed a vacation. We're a trauma center, not an all-inclusive wellness resort. I don't think group therapy with severely traumatized people will be all that relaxing. And no, we don't offer daily massages and cocktails. That happened more than once. Colleagues, please don't try to bind up scarce resources, even if you like the patient and they really do need a vacation. Story 20. Not a doctor, but cath lab tech. Had a patient's wife sneak him a sandwich before his hard cath. Not supposed to eat before since we use some sedation. And they didn't tell any of us despite many times confirming he did not have any food or drink. The patient then threw up and aspirated during the procedure. Ended the rest of his week in the ICU and almost died because his wife snuck him food. Please listen to your healthcare provider's instructions before procedures. These rules aren't in place to torture you, but to keep you safe. That's a wrap for this video. Make sure to leave your relatable story down in the comments. I would love to make a video on them. Also, don't forget to like and subscribe. See you next time.